All right, so you met with your surgeon, you've talked about what kind of surgery you want, you've talked about your goals, you talked about a cost, you're ready to go. But then you talk to your family and they're not really supportive of it. What do you do in that situation? Unfortunately, I have seen patients in this situation before, and there's really two different patient populations that this tends to happen to. You have kind of the younger patients where they come in maybe for a nose surgery and they want to change the shape of their nose. That tends to be younger boys and girls who generally are having self-confidence issues because of their appearance of their nose. For the most part, parents are very supportive of this, but every now and then there are parents that are not supportive of it. On the other spectrum, you have older adults who want to reduce the signs of aging and want to look more youthful and may seek cosmetic surgery for that purpose. And sometimes the spouse isn't that supportive, or maybe the rest of the family is not super supportive. Maybe they're just afraid of the risk of surgery. Maybe they're afraid of the way you're going to look afterwards. There are a lot of reasons why your family may not be supportive of your decision to pursue cosmetic surgery. At the end of the day, it's a very personal decision. So your decision should be based on you. Don't do this for someone else. Don't do this because of the potential benefit that you might see for a job or maybe a significant other or somebody that you're trying to impress. This is really for you. And the only reason, in my mind, that anybody should get any surgery to alter their own appearance is if it's affecting your confidence. My name is Dr. Peter Vila, and I'm a facial plastic surgeon. The way this generally works is that when people come in to talk about concerns they have about their appearance, whether it's a deformity of their nose or just the fact that they're looking a lot older than they feel, I want to make sure that I'm also seeing those things, because that's really one of the first things I look for is, can I see what the patient is describing? For me, that's often a reason when I have to say no, when either the expectations are just not quite right and I don't think it's going to be a good fit, or maybe I just don't see what it is the patient is talking about. And I don't mean that in a bad way, but I mean that to say that I know that based on my skills and what I can deliver with the surgery, it's just not going to be something that makes the patient happy. And at the end of the day, every plastic surgeon, including myself, just wants a happy patient. And the way that I know I'm going to make my patients happy is by understanding their expectations and delivering on those expectations. So unfortunately, if I see something that I know I'm not going to be able to satisfy, then I'll have that conversation, frankly, with the patient. Having said that, if we get to that point where I understand what you're saying, I see what you're talking about, and we both agree on what we can do and everything else kind of checks out, then it becomes, okay, now this patient may have a family member or a spouse, for example, that's not super supportive. And why is that? Well, honestly, I think it's coming from a place of love. And I can't speak for your family or, your particular situation, but oftentimes family members want to love their family for who they are, right? We all grow up with that. We all want to love people for who they are and love them with all of their imperfections. And so sometimes when someone decides to pursue plastic surgery, we're sort of changing that, right? We're almost challenging that idea that, you have to get surgery to look a certain way. And maybe they're afraid that if, for example, the wife gets surgery, the husband might feel like, is she going to expect me to do something to reciprocate? And that's a valid concern, and that's going to be different for everybody, and that's an honest conversation that should happen. And it's not really for me to say whether the expectation is there or not, but that's a conversation that you should have with your spouse, and that should be very upfront as far as your decision to pursue surgery and what your motivations are for surgery. Sometimes spouses might feel threatened. They might feel like, my wife is going to look so much better, she's going to leave me for someone younger. And, oftentimes I think really it goes back to, what are your motivations for seeking surgery? If it's for self-confidence, to look better so that you feel better, then that's an honest conversation you should have with your spouse, right? And so that's something to consider, that I think oftentimes we lose sight of the fact that it's really for yourself. When it comes to how people might expect to look after surgery, my goal is always to look natural. So if everything goes well, you're not gonna look like you had surgery or like you had a procedure done, whether it comes to things like non-injectable treatments like Botox or fillers, or a surgery in the operating room like a rhinoplasty or a facelift. All of those things are going to have little tiny signs that someone might be able to find, but if it's just a plastic surgeon that knows exactly where to look for that scar, that's very different than your family or just walking by somebody on the street, right? So I think the expectation for me is that the patient always looks like nothing was done, and good results should just look natural and subtle. What we're doing is we're trying to get you to more of an aesthetic ideal and less as far as something that is more noticeable, right? So for example, a breast augmentation, which I don't do as a facial plastic surgeon, that's super noticeable, right? It's like, whoa, look at me. Whereas a rhinoplasty oftentimes makes the nose less noticeable. So we're talking about restoring an aesthetic ideal and making things blend in better. And oftentimes with the aging face, we're talking about making you look more youthful. No one knows how old you are, and if you can reduce some of those wrinkles and reduce some of those signs of aging, you're gonna look younger. And oftentimes people say that they wanna look how they feel. When they're getting older and they start to see themselves looking back in the mirror and they just don't like that face that looks tired and wrinkled, there's things we can do about that. And that will make you look younger and feel better and hopefully get back out there and increase your self-confidence. So those are my motivations. And oftentimes patients share those motivations, and I will ask patients what those motivations are, but I think some of the fear of the unknown, where family members may not understand why a family member might want to pursue plastic surgery, and it just comes down to having a frank conversation about that before surgery and getting to the point where they can support or agree or maybe respectfully disagree, but they understand the reasoning for wanting to do that. So what are your motivations for wanting to have surgery? I want to hear from you. Tell me why you chose to have a procedure, if you feel comfortable disclosing that you had a procedure, or maybe you want to get a procedure done, and what are your reasons for wanting to do that? I'd love to hear from you. Thanks very much. I'll see you on the next video.